3 letters. Massive stakes. And most of the PTs I talk to are in one of two camps. They think MIPS applies to them when it doesn't, or they think it doesn't apply to them when it absolutely does. Both are expensive mistakes. And here's the thing, CMS doesn't send you a reminder. They just adjust your payments 2 years later and let you figure out what happened. By the end of this video, you'll know exactly whether MIPS requires anything from your clinic in 2026, and what the consequences are if you've been getting the answer wrong. MIPS stands for Merit-Based Incentive Payment System. It's CMS's Quality Reporting and Payment Adjustment Program, created under MACRA in 2015. It replaced a handful of older, fragmented Medicare reporting programs, PQRS, the Value Modifier, Meaningful Use, and consolidated them into one framework. Here's what it actually does in plain language. CMS watches how you treat Medicare patients, scores that performance once a year, and then adjusts your Medicare reimbursements 2 years later, either up as a bonus or down as a penalty. Physical therapists became MIPS-eligible clinicians in 2019. OTs and SLPs too, which means if you bill Medicare Part B, you are potentially inside this program right now, whether you know it or not. The context here matters. CMS has been deliberately moving away from fee-for-service. The direction is clear. Pay for outcomes and quality, not just volume of visits. MIPS is the bridge between the old world and that new one. Understanding that makes MIPS less confusing. It's not a random compliance checkbox. It's CMS building the infrastructure to reward clinics that can demonstrate quality of care with actual data. MIPS evaluates you across 4 categories. Quality, where most of your score comes from. You select outcome measures relevant to your patient population and report on them throughout the year. For PT, that's things like functional outcome reporting, falls risk screening, and plan of care documentation. Cost, CMS calculates this automatically from your claims data. You don't submit anything, but your billing accuracy and coding choices absolutely feed into it. Improvement activities, structured care delivery initiatives like telehealth expansion, care coordination, or fall prevention programs. Most PT clinics are already doing some of this. The issue is whether it's documented in a way that counts. Promoting interoperability. This one is frequently waived for therapy clinicians. Many outpatient PT practices don't use the type of certified EHR CMS is measuring here. You can apply for a hardship exemption, and that category weight gets redistributed to quality. Confirm your exemption status every single year. This is the most important part of this video. Not every PT clinic is required to participate in MIPS. CMS uses a low-volume threshold to exclude clinics. For 2026, you are excluded if you fall at or below any one of the following 3 criteria. 1. $90,000 or less in Medicare Part B allowed charges during the determination period. 2. 200 or fewer Medicare patients served. 3. 200 or fewer covered professional services. If you're at or below any single one of those, you're out. No reporting required. If you exceed all 3, you're in. Reporting is mandatory. The fastest way to know, go to qpp.cms.gov. The participation status tool takes 2 minutes to run your NPI. Do this at the start of every year. Your status can change year to year as your Medicare volume shifts. Here's where this gets serious. If you're required to participate and you simply don't report, CMS automatically assigns a penalty. The maximum negative payment adjustment. In recent years, that's been up to -9%. On a clinic billing $300,000 in annual Medicare revenue, that's $27,000 gone. No appeal, no warning. Just a payment adjustment that shows up 24 months after you decided not to deal with it. Submitting even minimal MIPS data, as few as 1 quality measure, can reduce or eliminate that penalty. This is one of the most asymmetric risks in Medicare billing. The cost of doing nothing is massive. The cost of doing something minimal is almost 0. If you're required to participate, there is no version of "I'll deal with it later" that doesn't cost you money. For a lot of smaller clinics, layering quality measure reporting on top of daily notes feels impossible. Clinics running on Spry have MIPS eligibility checks, tracking, and dashboards built in. If this helped clarify whether MIPS applies, drop your situation in the comments. Subscribe for more. If you are required to participate, Video 2 is exactly where you need to go next. Link is in description.